Hello everyone, this is Dr. Mayank Kulshrestha working as a senior assistant professor in a School of Pharmacy, BBD University, Babu Manar Siddhas University, Lucknow. Basically, today I'm going to discuss some diseases like hypertension, diabetes, mellitus, and cancer. These all three diseases will be discussed in deep. The presentation, which basically the diseases like hypertension, diabetes, mellitus, and cancer, which is a part of the subject social and preventive pharmacy. The subject code is BP802T from B from 4th year and 8th semester. So, first we will discuss what is hypertension. As the name indicated, the hyper means increases, tension means tense, something going to increase. Or here, the hypertension word used as respect of high blood pressure is a long-term medical condition in which the blood pressure in the arteries are persistently elevated. High blood pressure typically does not cause any symptoms. Long term high blood pressure, however, is a major risk of factors like coronary artery disease, stroke failure, arterial fibrillation, peripheral arterial disease, vision loss, chronic kidney disease, and dementia. So, it is a condition in which the force of the blood against the artery wall is too high. High blood pressure is classified into primary hypertension and secondary hypertension. Near about 90 to 95% of cases are primary defined as high blood pressure due to non-specific lifestyle and genetic factors. High lifestyle factors that increase the risk of blood pressure include the excessive salt in diet, excessive body weight, smoking and alcohol use, etc. The remaining 5 to 10% of cases are categorized as secondary high blood pressure, defined as the high blood pressure due to an identifiable causes such as chronic kidney disease, narrowing of kidney arteries, endocrine disorder, and use of birth control pills, etc. etc. Blood pressure is expressed by two measurements, the systolic and diastolic pressure, which are maximum and minimum pressure respectively. Mostly adults, normal blood pressure rests within the range of near about within the range of 120 by 80, 80 by 120. Here there is some mistake in presentation. The normal blood pressure is near about 120 by 80. This is a mistake. So 120 by 80 is correct. Now, WHO is decided usually to see the lifestyle of our people, our daily busy lifestyle. It is near about 140 by 90. High blood pressure, as earlier I told, often has no symptoms. Over time, if untreated, it can such as health conditions such as heart disease and stroke. Eating healthy diet with less salt, exercising regularly, and taking medication can help lower blood pressure. So these are some precautions. If we take some these precautions, so we can healthy our health. Lifestyle changes and medications can lower the blood pressure and decrease the risk of health complications. Life changes include weight loss, physical exercise, decreased salt intake, reducing alcohol intake, and healthy diet. If lifestyle changes are not sufficient, then blood pressure medication are used. Up to 3 medication can control blood pressure in 90% of people. The treatment of moderately high arterial blood pressure with medication is associated with an improved life expectancy. The effect of treatment of blood pressure between 140, 120 by 80 mmHg and 160 by 100 mmHg is less clear, with some reviews finding benefits and other finding unclear benefits. High blood pressure affect between the 16 and 37% of population globally. In 2010, hypertension was believed to have a factor in 18% of all deaths globally. Now we can now we can discuss. Here the image you can clearly see the heart has no hypertension, so the blood flow easily through vessels. The heart has high hypertension or hardening of the arteries. The blood flow may not be flow easily. So this picture clearly seen the effect of hypertension. Now we are discuss going to sign and symptoms of the hypertension and causes of this hypertension. So here you can clearly see that there is dizziness, there is irregular heartbeat, there is nausea, there is vomiting, there is fainting, low blood pressure, and fatigue. If we classify the causes and sign symptoms of a hypertension according to classification, so the causes of secondary hypertension are sign and symptoms of secondary hypertension are with like Cushing syndrome frequently causes typically obesity, glucose intolerance, moon face, a bump of fat behind the neck, shoulders. Such type of condition are creating. Hyperthyroidism frequently cause weight loss and increased appetite. Fast heartbeat, building eyes and tremor. Renal artery stenosis may be associated with the localized abdominal thrust to the left or right of the midline or in both locations. Correction of the aorta frequently causes decreased blood pressure in the lower extremely relative to the arms or delayed or absent femoral arterial pressure. Pheochromocytoma may cause abrupt episode of hypertension accompanied by the headache, palpitation, pale appearance and excessive sweating. Here, the important term is what is hypertension crisis. Severely elevated blood pressure equal to greater than 180 or diastolic 110 is referred to a hypertension crisis. Hypertensive crisis is categorized as either hypertensive urgency or hypertensive emergency according to the absence or presence of end organ damage respectively. In hypertensive urgency, there is no evidence to end organ damage resulting from the elevated blood pressure. In these cases, oral medication are used to lower the BP gradually over 24 to 48 hours. In hypertensive emergency, there is evidence of direct damage to one or more organ. The most affected organ include the brain, kidney, heart, lungs, producing symptoms which may include confusion, drowsiness, chest pain, breathlessness. So these are the basically signs and symptoms of hypertension. Now, causes of hypertension, as earlier I told, the salt, obesity, inactivity, alcohol, genetic, smoking, low potassium, calcium, magnesium diet, stress. So these are basically the causes of hypertension. If we categorized the basically the what is the cause of primary hypertension, so there are some insulin resistance will be take place, low birth weight, lifestyle, smoking, breastfeeding may the risk of adult essential hypertension. There are some lots of causes, and what if we talk about the secondary hypertension? So conditions like Cushing syndrome, hyperthyroidism, hypothyroidism, Cone syndrome, hyperaldosteronism, renal artery stenosis, hyperparathyroidism, pheochromocytoma. So these are some um, the reasons of hypertension. If we short talking about the pathophysiology of hypertension, so pathophysiology of hypertension included the renin-angiotensinogen system and baroreceptor system. If there is some problem or persist in the renin-angiotensinogen system, baroreceptor system, the blood pressure will be high. Basically, the baroreceptors are present in the brain, so they treat the hypertension. Now, we can discuss about the hypertensive drugs or agents. So there are lots of agents like ACB inhibitor, captopril, enalapril, angiotensin receptor blocker, losartan, renin inhibitor, amikacin, alicacin, beta adrenergic blocker, propranolol, calcium channel blocker, amlodipine, alpha adrenergic blocker, prazosin, central alpha 2 agonist, clonidine, methyl dopa. Diuretics will be there. There is a chlorothiazide and furosemide. vasodilator, arterial and arterial venous. So these are some drug which is given in case of hypertension. So basically, if we carefully read the pathophysiology of hypertension, we know about the what is the role of renin, what is the role of calcium channel, what is the role of beta adrenergic blocker. Now we are moving on diabetes. What is diabetes? Actually, diabetes mellitus is a disease that prevent your body from properly using the energy from food you eat. Diabetes occur in one of the following situations. The pancreas, the organ behind your stomach, produce little insulin or no insulin. Insulin is naturally occurring hormone produced by the beta cells of pancreas, which help the body use sugar for energy. Or the pancreas make insulin, but the insulin make doesn't work at it should. This condition is called insulin resistance. So, by the help of insulin resistance or insulin presence of absence of insulin, the diabetes divided into type 1 diabetes and type 2 diabetes. Recently, the two diabetes are also are find out the pre-diabetes and the gestational diabetes. So, diabetes mellitus, commonly known as diabetes, it is a metabolic disease that causes high blood sugar level. The hormone insulin moves more sugar from the blood into your cells to be stored or used for energy. With diabetes, your body either doesn't make enough insulin can effectively use or insulin it doesn't make. There are basically four type of classification of diabetes are there. Type 1 diabetes is also called autoimmune disease because the immune system attack the destroy the cell of pancreas where insulin is made. It is unclear what cause attack. About 10% of the people with diabetes have this type. Type 2 diabetes occur when your body becomes resistant to insulin and sugar build up in your body. Apart from that, there are two other type of diabetes like pre-diabetes or gestational diabetes. Pre-diabetes is a condition when your body blood sugar is higher than the normal, but it is not higher enough for a diagnosis of type 2 diabetes. Gestational diabetes is a high blood sugar level during pregnancy. Insulin blocking hormone produced by the placenta cause the such type of diabetes. So these are some two other type of diabetes. The blood vessels and blood are the highways that transport the sugar from where it is either taken it in stomach or manufacturing in the liver to the cells where it is used, like muscles, or where it is stored as a fat. Sugar is not able to go into inside the cell by itself. The pancreas releases the insulin into the blood where serve as a helper or key that lets sugar into the cell for use as an energy source of energy. When sugar levels the bloodstream and enter the cells, the blood sugar level is lower. Without insulin or a key sugar can go into inside the body cells for use as a energy. This causes sugar to rise. Too much sugar in the blood is called hyperglycemia, means high blood pressure. Here, what are the two type of diabetes? Type 1 diabetes and type 2 diabetes, as earlier I told, and I already discussed the gestational diabetes. Pregnant women who have a greater risk of developing gestational diabetes, including the factors like over 35 years of age, overweight, have a family history of diabetes, have a history of polycystic ovarian syndrome, which is also called the PCOS. Now, we are going to discuss what are the different causes of diabetes. These causes of diabetes basically are not known. The following risk factors may increase the chances getting diabetes. Like here, the presentation clearly seen the different the causes of type 1 diabetes, the causes of type 2 diabetes. So, family history of diabetes or a personal history of gestational diabetes. African American, Hispanic, Native American, Asian American races, Pacific Islander or ethnic background. Injury, some injury to the pancreas like such as infection, tumor, surgery or accident. Any autoimmune disease, age, risk increase with age, physical stress such as surgery or illness. There are risk factors that you may have not control over, including just like high blood pressure. abnormal blood cholesterol or triglyceride levels, smoking, being overweight, use of certain medication like steroids. So these are some causes of diabetes. Now, we are going to discuss the what are the symptoms of diabetes. The symptoms of diabetes include increased thirst, increased hunger, dry mouth, frequent urination, unexplained weight loss, weak, tired feeling, blood vision, numbness or tingling of the hand or feet, slow healing, sores or cuts, dry and itchy skin, frequent yeast infection or urinary tract infection. So these are the some common features including the diabetes. So when your body blood sugar is low, your body gives out the sign that you need different food. Different people have different system. You will learn to know your system. Commonly, early system of blood sugar included the following: feeling weak or dizziness, including the trembling or feeling shaky, feeling hungry, sweating, routing heart, pale skin, feeling anorexia, feeling confused or being able to keep your mind on one subject, headache, poor coordination, bad dreams, nightmares, feeling cranky, numbness in your mouth and tongue, and passing out. So, it is the basically possible treatment of diabetes like insulin and analog, which is the example is regular insulin. The adverse effect are hypoglycemia, weight gain, insulin allergy, the sulfonylurea, the molecule is glibenclamide. The adverse effect are hypoglycemia, weight gain, cardiovascular risk, rashes, cholesterol, jaundice, bone marrow damage. The bagnetide, the repaglinide, the biguanides, the metformin, firformin, the GLP-1 agonist, extendinide, DDP, DPP-4 inhibitor, sexagliptin, thiazolidinedione, pioglitazone, dual PAP agonist, saroglitazar, alpha glucosidase inhibitor, acarbose, amylin analogs, pramlitidine, SGLT2 inhibitor, canagliflozin. So these are the possible treatment of diabetes. But the people should take the low sugar level, regular exercises, make the discipline of your life so we can live healthy. Now we are concentrating on the very dangerous disease the called cancer. Cancer. Cancer is a disease involving the abnormal cell growth and the potential to invade or spread to other part of the body. These contrast with benign tumor which do not spare. Possible signs and symptoms include a lump, abnormal bleeding, prolonged cough, unexplained weight loss, with a change in bowel movements. While these symptoms may indicate cancer, they can also have other causes. Over 100 type of cancers affect human. Here the pictures include the different type of cancers like throat cancer, cancer of the esophagus, lung cancer, stomach cancer, bowel cancer, cancer of the bladder, prostate cancer, testicular cancer, skin cancer. In female, mostly throat cancer, cancer of the esophagus, lung cancer, breast cancer, stomach cancer, bowel cancer, cancer of the bladder, cancer of the uterus, skin cancer, ovarian cancer. So basically, these are some different type of cancers will be there. The risk of developing certain cancer can be reduced by smoking, maintaining a healthy weight, not drinking too much alcohol, eating plenty of vegetables, fruits, whole grains, vaccination against certain infectious disease, not eating too much processed and red meat, and avoiding too much sunlight exposure. Early detection through screening useful for cervical and colorectal cancer. The benefit of screening in breast cancer are controversial. Cancer is often treated with some combination of radiation therapy, surgery, chemotherapy, targeted therapy. Pain and symptoms management are an important part of care. Palliative care is particularly important in people with advanced disease. The changes of survival depends on the type of cancer, extent of disease at the start of treatment. In children under 15 at diagnosis, the 5-year survival rate in developed world is over average 80%. For cancer in the United States, the average 5-year survival rate is 66%. So this picture is clearly shown that the smoking is the main cause of cancer. Apart from that, it includes the 19%. Apart from that, the obesity 7.8%, the alcohol 5.6%, the UV radiation 4.7%, the physical inactivity is 2.9%, and the poor diet 1.9%. So there are there are some causes of cancer which is clearly shown in the pictures. Now, we can discuss the etiology, etymology, and definition. There are some basically some terms which is something related to cancer, like oncogene. Oncogene is a gene which have a capacity to cause the cancer. All tumor cells show the six hallmark of cancer. These characteristics are required to producing a malignant tumor. They include cell growth and division absent the proper signals, continuous growth and division even given contrary signals, avoidance of programmed cell death, limitless number of cell division, promoting blood vessel constriction, invasion of tissue, formation of metastasis. So there are six hallmark of cancers. Now we can discuss about the sign and symptoms of the cancers. So the local symptoms include local symptoms may occur due to mass of tumor or its ulceration. For example, mass effect from lung cancer can block the bronchi resulting in cough or pneumonia. Esophageal cancer can cause narrowing of the esophagus, making it difficult or painful to swallow. And colorectal cancer may lead to narrowing of the blockage in the bowel. Affecting bowel habits. Masses in the breast or testicular may produce observable lumps. Ulceration can cause bleeding that can lead to symptoms such as coughing, blood, lung cancer, anemia, rectal bleeding, colon cancer, blood in the urine, bladder cancer, or abnormal vaginal bleeding. Although localized pain may occur in the advanced cancer, the initial tumor is usually painless. Some cancer can cause a building up of fluid within the chest or abdomen. Now, the systemic symptoms. The systemic symptoms may occur due to the body response to the cancer. This may include fatigue, weight loss, skin changes. Some cancers can cause a systemic inflammatory state that leads to ongoing muscle loss and weakness. Some type of cancers such as Hodgkin disease, leukemias, and cancer of the liver or kidney can cause a persistent fever. Means in case of Hodgkin disease, leukemia, cancer of liver and kidney, the fever will be occur. What is metastasis? Metastasis is a spread of cancer in other location in the body. Is the spread of cancer to the other location in the body. The dispersed tumor are called metastasis tumor, with the original is called the primary tumor. Almost all cancer can metastasis. Most cancer deaths are due to cancer that has metastasized. Metastasis is common in the last stage of cancer and it can occur via blood or via the lymphatic system or both. The typical step in the metastasis in the local invasion, intravasation into the blood or lymph, circulation through the blood, extravasation into the new tissues, proliferation and angiogenesis. Different type of cancer tends to metastasis of particular organ, but overall the most common places or metastasis to occur are the lungs, liver, brain and bones. So these are the type of cancer. If we talk about talk about the pathophysiology of cancer, so it includes some genetic reasons, it includes some epigenetics, it includes metastasis, it includes metabolism. So these are some factors which affect the cancer. If we talk about the diagnosis or treatment about the anti-cancer drugs, so the anti-cancer drugs, there are lots of anti-cancer drugs will be there, like alkylating agent, like in alkylating agent, the nitrogen mustard ethylamines, the alkyl sulfonate, the nitrosourea, the triazine, the methyl hydrazine, apart from the platinum coordination complex and antimetabolites. In antimetabolites, there are lots of folate antagonists, purine antagonists, pyrimidine antagonists. Apart from there are lots of like vinca alkaloids, some hormones will be there, some other type of treatment available will be there. There are some terms which is related to cancer like carcinoma. Carcinoma means cancer derived from epithelial cells. This group include many of the most common cancers include nearly about the breast, prostate, lung, pancreas and colon. Sarcoma, cancer arising from connective tissue, each of which develop from the cells originating in mesenchymal cells outside the bone marrow. Lymphoma and leukemia. There are two classes arise from the hematopoietic cells, and leave the marrow that tend to mature in the lymph nodes and blood, respectively. Germ cell tumor, cancer derived from the pluripotent cells. Germ cell tumor, cancer derived from the pluripotent cell and offer presenting the testicles and ovary. Blastoma, cancer derived from immature precursor cell embryonic tissue. So these are some word or some word vocabulary which is related to cancer. Just as benign tumors which are not cancer, but the name oma as a suffix with the organ name as a root. For example, benign tumor of smooth muscles is called leiomyoma. So such type of including like melanoma, like seminoma. So these are some type of vocabulary which is something related to cancer. Apart from that, we should improve our dietary habit, medication habit, vaccination. So we can clearly if we avoid some chemicals, sunlight and some other things, so we can as early as possible we can far away from the cancer. So this is all about the diabetes mellitus, this is all about the hypertension, this is all about the cancer. Thank you so much for carefully listening. Thank you so much for carefully listening about the diabetes mellitus, about the cancer, about the thank you.